Yes, it will give you a very good amount of happiness, and that will end a very good talk because today I was a little bit of sleepy also. So.
Doctor, really it was an excellent talk. Your
Yeah.
photograph selection was
Yeah.
really nice. And the fact that you self-justified our beliefs when you talk about what can come in basic Ayurveda. So, but just tell me one thing.
Yeah.
It's a very common thing that people nowadays are avoiding orthopedicians. यार जाओगे उसके पास तो बदलने का ही बोलेगा.
Again, come to the same thing which we are seeing in the Hindi movies also. There is always a home doctor, family doctor. One doctor should be there to attach with that family. If that doctor says you go to this doctor is very good, so they can trust on that. Otherwise, what happens if they come to me? I say no surgery. Another surgeon say very bad. So confused. What to be done, Doctor Ajay? You are telling me surgery is not to be done. Another person is saying surgery has to be done. So that trust thing has gone. Treatment is same for everyone, but the trust thing is gone. So I think again we have to tell the patients that just fix one doctor for your family and stick to that. That family has to go to that family doctor only. After that, if that doctor suggests to go to this doctor or that doctor, that is that doctor decision, not because that's how they are misleading.
Excellent, sir. You saved the time also.
Yeah.
It is your credit. Any question, query?
Yes, sir.
Role of HRT in post-menopausal osteoporosis.
To prevent
Post-menopausal osteoporosis. Role of HRT.
role of anxiety.
HRT.
HRT. Actually, sir, I have not seen that much like postmenopausal things. What I prefer is my first most important thing for any anxiety or any depression or any postmenopausal. I tell them to start with the routine checkup of bone mineral density reports and keep check on your calcium, vitamin levels. And very most important thing is hydrotherapy. I tell them to go for a swimming, which is I think nowadays I am seeing the more those who don't want to take any tablets or any treatment. I suggest them to go for a swimming. Half an hour of sleeping, not doing anything, just sit in the swimming pool. They are getting a very good relief, very good like sleep also. They are very hungry also. Some people of postmenopausal osteoporosis patient are not that much hungry also. They are telling भूख नहीं लग रहा है, कुछ अच्छा नहीं लग रहा है. They have a lot of hair falls, lot of negative thoughts. So that is all.
I'm asking for hormones.
Hormones. Hormones. No, no. I have not seen, sir. Like I have suggested so many people to go to for the doctors and give some treatment, but I don't think not working on that.
Hormone
you, doctor.
replacement therapy as such has been controversial, whether beneficial or not. Over the period of time, the opinion have started changing. Thank you, Dr. Ajay.
Thank you, Dr. Devra. I would like to for some time. I would like to thank Dr. Devra sir for giving this wonderful talk. Definitely, we all will be benefited, and our patient will be benefited. I would like to request Dr. Ravi Doshi sir, please facilitate Dr. Devra sir. Thank you for the wonderful talk. Thank you all the chairpersons. And one more thing, Dr. Ravi Doshi has come all the way from Indore, so I would like to request Dr. S.K. Jain sir, please come and facilitate Dr. Ravi Doshi, who has taken out his time for us. Please, sir, please.
I would just utilize this opportunity to thank all of you I am also the clinical secretary of IMA Indore, so I am so glad that IMA is taking up its activities in this part of Madhya Pradesh, which is truly unexplored medically, I would say, because we are all always exporting our medical stuff, not importing it. So a big thanks to IMA Dashpurkon. This is a good thing, and I am a son of the soil. My whole family belongs to Mandsaur. So thank you for this special gesture. Thank you very much.
Thank you all the chairpersons for sharing this session. I would like to call next chairpersons for the next session. Thank you, ma'am. Thank you, sir. Thank you. So for the next session, for chairpersons, we have Dr. S.M. Pamicha, sir. Sir, please come. Dr. Pamicha, sir, please come. Dr. M.L. Gandhi, sir. Dr. K.R. Patidar, sir. Dr. P.N. Adas, sir. Dr. Mahindra Patni, sir. Dr. S.S. Verma, sir. Our next lecture is by Dr. Atul Bajpayee, sir, who is Professor and Head, Department of Neurosciences, Pacific Medical University, Udaipur. Sir is having a vast experience of 20 years, and sir is having more than 100 national presentations. I would like to welcome Dr. Atul Bajpayee, sir, on behalf of IMA Mandsaur. Thank you, sir. Please come.
Very, very good morning, respected chairpersons, esteemed colleagues. First of all, my heartiest gratitude to Dr. Chelawal Sahab, BS sir, for having me here. This is slightly offbeat, the talk which I am going to deliver over the next 20 minutes or so. Scientific basis of spiritualism and its application, be it in life of patients or doctors. So from bone to brain, let's change. Can I have the presentation, please? Just put my presentation. This is my CV slide. I have been introduced enough, so you can change it. Thank you. So science is a profound source of spirituality also. I'll be just sharing our own experience. So I can, following overheads, I'll be introducing how it evolved.
बस बढ़िया है अजय आया तुम्हें अजय का आइडिया नहीं है मेरे
Evidences, application, role in healthcare and our own experience and research in this. Neurotheology. This is the subject which is relatively not known to everyone. This is neurological basis of spiritualism. You all know brain is something what you see and mind is something you don't see. So basically you have almost more than 6,000 messages going every day in your brain, and these thoughts are processed and you have different expressions. First of all, as I was told very specifically, within time limit. So health, we all knew in our community medicine, health is a state of being in physical, mental and social well-being. We read it. And WHO has added fourth domain also, that's spiritual well-being. So there was a Danish paper, it had more than 1 lakh patients, caregivers. So there are spiritual needs of your patients, and doctor just briefly touching all these aspects. In West, if you see the West literature and definition Oxford Dictionary. So that is something, in Oxford, the dead people, they are talking to the living beings through some especially empowered people or medium. So that's spiritualism definition. In Hindi, that is called Pritatma, which is not the case here in Indian system, which is Adhyatma. Adhyatma means जो आत्मा से और आत्म परिचय कराए अध्ययन के द्वारा, उसे आध्यात्म कहते हैं. तो हमारा बेसिकली जो मानना है स्पिरिचुअलिज्म का, अध्यात्म का, जो हमारे जीवन में प्रेम, शांति, संतुष्टि, ये सब चीज लेके आए, उसे हम आध्यात्म बोलते हैं. Well, I mean, these are the three questions. You all know IQ. IQ is genetically more or less fixed. A genius or a moron, you can change it slightly by any practice, but you cannot, change it significantly. Then, and it's a function of left brain primarily. Then you have EQ. EQ means emotional quotient. IQ is a measurable scale. I mean, you can measure it IQ by various means. EQ is emotional intelligence. So you have empathy, compassion. So IQ multiplied by empathy, compassion and wisdom is EQ. So that's emotional quotient, which is function of your right brain. So this is something those who understand computer, right brain works like a parallel processor, left brain works like a serial processor. So IQ, EQ, different hemispheres responsible. So these are two questions we know of. But when brains start working in a holistic manner, you start using both hemispheres in a very synchronous manner, there you develop a spiritual quotient. So synchronous processing of whole brain, so I'll be coming to how you can, so SQ is very important, spiritual quotient. So this is the highest form of intelligence, SQ. Well, you all know, there is always a law of conflict. I know, if I am fearful to darkness or flying in the air, whether I know that logic says there's nobody dies when you fly in the air. Accidents are very less. But if you have a fear, your right hemisphere wins over logic or left hemisphere. Just putting it across, one of the study in brain, when they studied, which is very relevant to today's, environment also, they studied radically converted people. So these people have, their dorsolateral prefrontal cortex activity is less compared to ventromedial prefrontal cortex. So you can actually pick it up on imaging, on MRI or functional imaging. So they have, so why this is? Because dorsolateral prefrontal cortex is responsible for reasoning, and why this ventromedial prefrontal cortex, it has, more, it doesn't calculate risk, and it just has, they have high willingness to die for a cause, they think, which is appropriate. Well, so as I was saying, so it is important to increase your spiritual intelligence, which is the highest form of intelligence, because it can contribute to your personal life. You become more satisfied, more happy from inside, and that's how you start ignoring small trivial things in the family, so your family life becomes better. And the family life is better when you go to work, your workplace becomes a joy place rather than a daily chore to earn money. Spirituality has evolved, so is the evolution. Human brain, unlike any other organ in the body, it has a history of 500 million years. So basically 500 million years, if you see a brain of that's mainly cerebellum. That's a territorial brain. You go in, you encroach in territory of a snake, it will bite you. So that's a territorial brain. Then what happened? The neocortex, neopallion and new brain evolved. So why I am saying this, that spirituality is a function of neocortex or new brain. So primates have it, a dog has, empathy, compassion, so as the human being, but you cannot fondle a snake like this. So basically, the brain consumes 20% of your whole energy, despite of being, 1 to 2% of your body weight. So it is because of high energy demand. And why this is so? Because we humans have started consuming diet, high calorie diet, started using tools, talking about evolution time, and social complexity. We have to live in groups, societies, and find solution to the problems. Okay, So basically, here if you see in the modern neuroimaging, actually you can see this is just for your information. This is a coronal section of MRI brain. So you draw a line from this singular circus to collateral circus. Everything inside is old brain, and everything new is outside is new brain. It is important to understand not only the diseases, pathophysiology. One should have basic understanding the how brain looks like. So brain is, you all know, it's like 3 pound or 1.4 kg organ, protected by skull wall. This is like 2 jelly cups which are connected by corpus callosum. Okay. So this is how it looks like, just an anatomical substrate. Why I am just putting this across? There is something called default mode network. So if you join these areas, I was talking of medial prefrontal cortex, because our prefrontal cortex is one area which is responsible for concentration, logic, reasoning. Okay, so if you join this area along with medial frontal precortex, angulate cingulate cortex, posterior cingulate cortex, this is, you don't have to remember all these things. Default mode network is important because this is also called bandar brain. In rest, it is just wandering, distracted here and there. So you have to really control it with certain things, including meditation also. That's what I'll be. So I'll be skipping many of these slides. So you all know this. So there is something called, you have an intuitive, quick limbic response to any particular problem or activity. Your hypothalamus gets excited. So what do? You either have flight or fight. Amygdala is hijacked. Prefrontal cortex is suppressed, which is responsible for logic, reasoning. Okay. So there are various coping strategies to avoid these situations like deep breathing, mindfulness, etc. Many times it is said that sometimes willpower fails, especially in people who are addicted. So this is one thing which is called uncontrollable pain. There are 2 important circuits in our brain. One is dopaminergic circuit, which is responsible for reward, control, and another is serotonin pathways, which are responsible for mood and arousal. So because this is something, this is one functional MRI image. So basically in our brain, if you see like here, the basal ganglia, which is curator, amygdala, which is sentinel, and ventral stratum, which is rewarder. So what you do every day, this is a ritual. Suppose you get up early morning, do your breakfast, you are in time, so you develop a ritual in a child. Okay, over a period of time, this has become less and less effort-related activity. So that ritual becomes your routine, and then routine becomes your habit, sanskar. तो जब संस्कार बन जाते हैं तो शुरू में ही, so these 3 areas in the brain are responsible for making habits or sanskar which you have to modify in a child or inculcate in a child right from the beginning. So this is what it is. There are various kind of spiritual experiences. Spiritual experiences, common things, it is always very intense, clear, it gives you a sense of unity, surrender, and it is permanent in nature. I will not go in details with spiritual experiences. Various religions have cited this spiritualism as part of their, and how do you practice them. So again, whether it's Islam or Jainism or Hinduism, so all I'll not go in religious details. Okay, so this I'll skip. So basically, from my side as a neuroscientist, what are the evidences that spiritualism does exist, and what is exactly what we need to do for this? So on this background, we have 3 things. Okay. Number 1, we have psychometric testing, IQ, EQ, spiritual quotient. These are measurable scales, or your test 42, that depression, anxiety, stress score. So we have numerous psychometric tests. So this is our own initial study which was published. We did in almost 200 patients. That was in COVID time. Second thing is you can do EEG, which will show you real-time changes in the brain. Alpha is a meditation wave. So once you have more and more alpha activity, you have more and more, you start doing meditation and you develop more volume of alpha activity. Second is your EEG. So here we did neuropsychometric testing, which improved after doing meditation of half an hour per time. Another thing is, you can even see somebody who has flashes of light, you can see this striking in the occipital lobe. So EEG can document meditation. And third thing, you have imaging, functional MRI. So many times this functional MRI I will again skip many because I have too many slides probably. So the basic thing which I will emphasize here to explain you the neurological basis of spiritualism is this is before, this is spec before meditation. This is after 12 weeks of meditation. What you see here, this red thing, less of red here in the parietal lobe. So after meditation, your parietal lobe slows down. What does it mean? Parietal lobe, we all know, is responsible for orientation to time, place, and person. That's all. I mean, that's all we all read it. Second thing that is happening here, something you see before meditation here, red is appearing after meditation. So this is more intense, more red. So your frontal lobe lights up. Frontal lights up, parietal slows down. And third thing what happens, your temporal lobe gets activated and you have immense spurt to your limbic system. Now I will explain this thing. Your frontal lobe lights up, you become more attentive. Your parietal lobe slows down. So you feel one, you lose this self-world dichotomy. You feel you are one with the world. So that is what happens. When there is immense spurt on limbic system, that gives you immense kind of joy and ecstasy, which is not attainable by any worldly, pleasure. So this is the zenith of spiritualism, and that is how brain works in those times. This is Kirtan Kriya was another thing, Satyanama. So that was done to enhance memory, and they have shown that memory area gets, more active during that time. Some of the divine experiences could be, play of electrochemical activity in your brain. So this is meditation pathway so most important thing is mystic experience. I mean, people say at one point of time, मैं ब्रह्मांड में विलीन हो गया. You feel one with the world. So that's called AUB, aura of being united with the world. So that happens when there is complete differentiation of posterior superior parietal lobe, excessive activation of temporal lobe, and you feel one with the world. So this is what it is, AUB, absolute unitary being, which is zenith of any mystic experience. Well, it has various applications. As Sir was telling me, spiritualism has a very important role to play here. Based on that, your leaders become sometimes autocratic, sometimes democratic. So this is again very important, that how the spiritualism is all about. Societies, different societies, Indian society, Western society, Arabic, why these are so different? It is all in the brain. It is all in the spiritual practices every society has. That at individual level, it does play a role in health. At business, it is important to implement because many bosses would give 7 tasks to a person. He will fail. He is bound to fail. A best of the employee can fail. So you have to use this principle of spiritualism so as to enhance productivity and happiness in your employees also. A good leader in corporate or in public should, these are 5 features: accountability, adaptability, confidence, creativity, empathy. So 3 of them would develop once you enhance your spiritual quotient. So the most important thing for a doctor to teach is not to take medicine but to enhance your spiritual quotient. Being a neuroscientist, I know 70% of my diseases are psychosomatic in origin. Migraines, headaches, body aches. So basically you have to go to the root cause symptomatic there only. Well, now I tell you, how did I venture into this neurotheology? As a young interventionist, when I started doing neurointervention, a 19-year-old boy with a middle cerebral artery occlusion here, he came to me. Okay, there was tight stenosis in the central carotid artery and tendon occlusion in the middle cerebral artery. So obviously, patient is on window period. We immediately took cath lab, opened the carotid artery, recanalized the middle cerebral artery. Everything was fine. But when the boy was shifted, is it okay? So fine. So the next day when I went to round, the boy was speaking something, Amiku Sarda. I did not understand. At that point of time, there was a Bangladeshi colleague of mine who was there with me in the rounds. He's saying he's ugly in Bengali. That time my feeling was, oh, I did some complication. He's now having jargon speech, some kind of neologism. But he was saying he's talking, when I just, put it, chalte around, there was complication, because I was not sure about that, and anyway, over 2 days he became all right. So the child developed a new language. Maybe I had hit some clot somewhere in the brain. I really don't know. But it was a minor insult, so he recovered. But now then I served literature, and that's what many times I thought that is maybe a mystic thing, but it has a scientific basis here. So then we formally we took up this neurotheology as a subject and started doing research on that. I followed this 8 limbs of yoga, which gave me a lot of things. 8 limbs, yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi, 8 limbs. I tell you how. And this is the last publication we had, and almost more than 2,000 patients. This is my module of work. This is all half an hour module, which includes meditation, asanas, breathing exercises. Okay, I can give you. So I'll quickly, these were the results. The stress and anxiety were less. So family relation and all these things improved, they transformed. So here, what I started doing, when we were doing this thrombectomy, we started doing this thrombus sample which we are getting out of, the thrombus sample which we are getting from the middle cerebral artery, we subjected them to next generation sequencing. And you will not believe, we found almost 27 bacteria from a sterile compartment called plain. And we have published it. It's internationally published and accepted study. All of them are non-pathogenic bacteria living in and around our body. Tef, not aureus, epidermidis. Pseudomonas, not aeruginosa, sorry. So how do they produce pathogenicity in the form of stroke or heart attack? That's what we published. So these are the mechanisms, I will not go in detail. One of them was they produce acetic milieu in the plaque environment where LDL oxidation gets 100 times faster and produce plaque instability. So there are other various biofilm formation in them you can read. So there are various mechanisms. But the idea was here, Vidra, that came from Ashtanga Yoga. Vidra means lack of hygiene somewhere is responsible for heart attack and strokes, and that is clinically, it has been established and published also. Okay. Another thing, I'll skip this for the lack of time. This is important. When I was doing mechanical thrombectomy, it cost around 3 lakh rupees. All of these patients were asking me, पैसे तो दे देंगे, but what is the level of assurance that patient will become all right? When I started this thing in the South Rajasthan, it was a difficult thing to answer. At that point of time, thrombectomy was not done anywhere else, so it was difficult for me to explain. What we needed some biomarker, like in heart they have trophy, citric acid, etc. So we did not have any biomarker in stroke, which can prognosticate, which can tell us whether this thrombectomy is going to be useful or not. Okay, so this DNA, which is in every neuron, we started using this DNA as a biomarker. Again, these are all published things. So now it is true that cell-free DNA, you measure it, how that it is not only a diagnostic marker, it gives you prognosis, it gives whether you need to do thrombectomy or not. And lastly, it is a treatment target also. You can do something like DNA therapy, because cell-free DNA is like bacteria in your blood. It produces a lot of inflammation. Okay. So this is it works like a stroke clock. So this is the problem here was we are getting results in 5 to 6 hours. So it is not replicated in clinical practice as of now. But soon that will change. Because inflammation is 90% is not true. So plaque inflammation is the key. So what can you do? In major thing missing in stroke or heart attack armamentarium is anti-inflammatory medication. Statin to some extent it does. There is no strong anti-inflammatory medication in our treatment to heart attack and stroke, which is the key thing. You know, do a drug trial so easily in our country. We started using turmeric, which is super drug, curcumin. So we published again, everybody can take curcumin milk. We did almost 200 patient study, which is published now. Curcumin improved outcome immensely. Okay. So these were various our publications. This is what I am coming to the selfie plasma DNA. We are trying to make it a POCT, point of care device, which will give you result within few minutes. So nano drop, then microfluidics, DNA chip, and probably this paper based like a pregnancy kit. So probably in another 1 year or so we will be able to produce this device, so it can be done within few minutes. So that could be a stroke clock also. Last slide. The spiritual need of patients, doctors and caregivers is very important. As a doctor, you should always, this hope is a very simple scale, one should ask their patients, what are your strengths of the patient when you are treating a patient, especially a patient with chronic diseases? Do you follow any organized religion? Do you have some personal spirituality practices? and what are the effect of those practices on a treatment which I am giving to you. So this is very important. It's really because patient is dependent upon you, it will give him a sense of belonging, empathy and faith on you. And doctors themselves in a stressful job, chaotic work, day in, day out, they need to do some yoga or going to nature, whatever their spiritual need is, they should practice their spiritual practices also. And this is how, this whole neurotheology is shaped up, and we produce it, and we do this meeting every year with the spiritual leaders on one side and neuroscientists on the other side. And I invite you to this meeting on September 27th and 28th in Udaipur. With this, thank you very much. Any questions or comments? I was slightly bizarre, but you asked me to finish in time, so yes, sir.
Thank you. Very nice way and guided us to human meditation, and it is a lesson for all of us that in your regular practice we must realize the importance of spiritual meditation for the all practical purposes. Thank you very much.
Thank you, sir.
Thank you, sir, for a very nice talk on neurotheology. Now I would like to invite Dr. Pamecha sir and Dr. Gandhi sir to felicitate Dr. Vajpayee sir.